Hi, my name is Jonathan. I'll be your nurse today. So today we're going to be doing a physical assessment, and I want you to sit down at the edge of the bed, as you are right now. And right now we're going to start with an inspection of the head. So it looks like the head is normocephalic. Yes, and it is symmetrical bilaterally, so that is good. And now I'm going to palpate your head, if you don't mind. And there, I don't feel any masses or any lesions, but as I palpate, do you feel any tenderness?
No, I don't.
Okay, and I'm going to inspect the hair right now. And it is black, smooth, and the texture is soft. And it is evenly distributed. And let me see. And there appears to be no parasites on the hair. So that is good. Okay, so now I'm going to inspect the face. And it looks like the face is oval shaped and it is symmetrical on both sides. And I'm going to look for involuntary movements. And there is no involuntary movements. Okay, so now I'm going to look at, I'm going to test you on cranial nerve 7, and I'm going to ask you to do some of the movements I'm going to be saying. Okay, so I'm going to have you raise your eyebrows. That's good. Wrinkle forehead. Smile without teeth. Smile with teeth. Purse lips. Puff cheeks. And frown. And whistle for me. Okay, thank you. And you're able to do all of the cranial nerve 7 movements, so that is good.
Alright, so now I'm going to be examining your eyes. I'm going to just elevate the bed.
Alrighty.
Alright, so checking out your eye area, the eyebrows are evenly distributed. There's no lesions or scaling, and they're symmetrical bilaterally. Your eyelids, there's symmetrical. There's no drooping or redness. Are you in any pain right now? Okay, there's no pain and no drainage or tumors. And your eyelashes are symmetrical and evenly distributed. They sweep upward from the upper lids and downward from the lower lids. Let's see. And now I'm gonna look at your conjunctiva, if you don't mind. Alright. Your conjunctiva is moist, light pink with no foreign bodies or lesions. And I'm gonna check out your cornea. The cornea is, there's no cloudiness, it's moist, no discharge, and it's shiny. And your sclera is white. There's no lesions, there's small superficial vessels, and there's no exudate in the sclera. And your iris is brown, and it's evenly distributed, smooth, and without vascularity. So now I'm going to assess your alignment of the eyes by using my pen light. So I'm going to shine this pen light in the middle of your forehead and just look right at me. Okay, so the corneal light reflex is symmetrical in the center of each cornea. Now I'm going to test your 6 cardinal fields of gaze. If you can just follow my finger just by using your eyes, don't move your head. Alright, so eyes were able to move smoothly and symmetrically in each field of gaze with no nystagmus present. So now I'm going to test your pupil response with the pen light again. I'm going to start. It's going to come from the side, it's going to go into the eye. Alright, so now I'm going to shine the light in one eye and I'm going to check for response in the other eye. So both pupils constricted briskly to the light. The pen light, when the pen light was shined in one eye, the other eye consensually constricted with the other one. And now I'm going to check for accommodation. So if I can have you stare at that cabinet for 30 seconds, and then I'll have you stare at the pen light right after that. Alright, you can stare at this pen light. Okay. So the pupils constricted and converged to focus on the closed object. So now I'm gonna inspect your internal structures by using the ophthalmoscope. You can just look off into the distance for a second. Alright, so you can look into the light right now. Alright, so okay, so the retina emits a red reflex. You can see.
I'm sorry.
It's alright.
I'm sorry. Okay, I'm sorry, guys.
Alright. The optic disc is pinkish and orange, and let's see, and the fovea centralis is present. Alright, that's it.
So I'm just gonna inspect your ears now, and I see that they are the same color as the rest of your body, and there's no redness or swelling, no lesions seen. I'm gonna palpate. Do you feel any tenderness when I do this? No. And I don't feel any masses or lesions. And I'm gonna test your tragus. Do you feel any tenderness when I do this? No. And what about this? No. Alright, so there's no tenderness on her tragus or mastoid. Next I'm going to do the whisper test. So can you stand up for me? And can you occlude your left ear? And repeat the word that I whisper. Yellow. And include your right ear. Purple. Okay. So her hearing is intact. You can go ahead and sit down again. And I'm going to look in her ear with the otoscope. Okay. So I'm gonna pull back and up. And I see no excess wax. The wax is a light yellow color. The auditory canal is a light pink. There's no swelling. The tympanic membrane is pearly gray. It's concave in shape. And in the left ear, the cone of light is at 7 o'clock. And there's no lesions or masses. And next I'm going to do the Weber test. So I'm going to hit this, and then I'm going to put it on your head, and can you tell me if you hear it equally in both ears? And do you hear it equally?
Do it one more time.
Do you hear it equally?
Yeah.
Okay. And next I'm going to hit it again and put it behind your ear on your bone here. And you're going to feel it buzz. Once you stop feeling it buzz, tell me. And I'm going to put it in front of your ear, and you're going to tell me yes or no if you can still hear it. Okay.
No.
Do you still hear it?
Yeah.
All right. So air conduction is greater than bone conduction. Which is good. That's what you can leave now. Yeah, okay.
Right. Patient's nose is symmetrical and centered midline. There's no discharge. Could you please lean your head back for me? All right, there's no septum deviation masses or bleeding. And now I'm gonna palpate. Tell me if you feel any pain. No masses detected, no tenderness, and no displacement of the nose.
Okay, so patient lips are pink, moist, and no lesions. No lesions found. And can you say ah for me? So, and stop. So, patient's uvula rises with phonation. And can you open your mouth again? And patient's tonsils are graded at a +1. And could you move your tongue side to side, please? And up to towards your nose, down towards your chin. Okay, you can stop. Patient's tongue is symmetrical and moves freely.
I don't see any lesions or masses on your neck. Okay, can you do this for me? And then this, and then this, and this, and then rotate left and right. Okay, so you have a full range of motion in your neck, and can you move your hand against my resistance? Okay, and on the other side, and then can you shrug your shoulders against my resistance? Okay, so 5 out of 5 strength for your shoulder shrugging and for your when you're turning your cheek against my resistance.
Oops, the bed is so. Okay, go. Alright, so now I'm gonna inspect and palpate your nails. Okay, your nails are nice and a little pinkish. So that's a normal color. No splitting. They are smooth. Can you go like this? Okay, the angle is less than 160. Can you see your hands again? Alright, now I'm gonna press on them. Okay, capillary refill is less than 3 seconds. Now I'm gonna pinch your skin slightly. Okay, no tenting, so you're not dehydrated, which is good.
Okay, now I'm gonna check the range of motion and strength of the elbow, wrist, and fingers. First, we're gonna do the elbow. I want you to do this, and I want you to flex the elbow, put your elbow to the right, okay, just straight in the hand. So the patient was able to flex her elbow hand at 90 degrees, and I want you to do. Can you stand up, please, and extend? Okay, no, it's not 0. Okay, so it's 0 degree for extension, and now I want you to. Okay, I want you to put your elbow, put it the ulnar on the table, and I want you to do supination. Supination means you have to put your palm up, yes, and then go back and put your hand down. Good. So the strength is 5 out of 5. Oh no, this is the flexion. Sorry. So she was able to do 90 degrees on supination and 90 degrees on pronation. And then the strength, I want you to, strength of the elbow, I want you to hold this. I want you to pull it while I'm applying resistance. Okay, don't put so hard. Just very strong. Okay, do the same thing. Okay, good. So the strength is 5 out of 5. So she's very strong. Okay. So now we're doing the wrist. So for the wrist, I want you to. Okay, I want you to put your hands like this on the ground, and then I want you to move your hand so that way. Yes, and then extend it. Extend hyperextension. So she was able to flex it 90 degrees and extend hyperextension for 30 degrees. Okay, so now I want you to the strength. You have to show the strength. I forgot. Strength. Yeah, that one. So I want you to pull with resistance when I'm applying resistance. Good. Then do the other one. So I want you to pull. Okay, good. So the strength is 5 out of 5. And now I want you to grab my hand grasp my fingers and squeeze as hard as possible. Good. And then release. Good job. So see, the strength is 5 out of 5. And now, I have to check your radial pulse. I want to check the quality and if it's symmetrical. Okay, good. So the quality is +2 and they are symmetrical bilateral. Thank you.
Okay, so I'm going to do the Tinel's test for carpal tunnel syndrome. So I'm going to tap your median nerve. Do you feel any tingling or burning?
No.
Okay, I'm going to do the same on the other hand. Any tingling or okay, so the patient is negative for Tinel's test. And I'm also going to test your fine motor function. Go ahead and touch your nose with your alternating index finger quickly. Okay, that's good. Rapidly touch each finger to your thumb. Very good. Go ahead and alternate between touching your nose and my finger. Okay, so there's no overshoot or undershoot. And go ahead and pat your knees rapidly, supinating and pronating rapidly. Very good. So the patient has adequate fine motor function.
I'm gonna do a performance or something. Alright, you lift up your for me. Thank you. Okay. So I'm gonna examine your back. It looks like your skin is smooth, free of lesions. There are a few moles noted. The back of the thorax is symmetrical. Now I'm going to test for the tactile. So just say 99, okay?
99, 99, 99, 99,
One more time.
99.
Perfect. Now I'm going to do your sides, okay?
Yes.
99, 99, 99.
Okay, thank you. Okay, now I'm going to auscultate your lungs, and I'm going to ask you to take a deep breath for me, okay? Okay, ready, go. Two more times. Hold on. Okay, go. Perfect. And I'm going to check your sides. Ooh. Okay. Deep breath. Deep breath. One more time. Okay, I'm going to come this side. Deep breath. Okay. Deep breath. Okay. And one. I don't want to pinch you, sorry. Okay, go. Okay. So, breath sounds are noted in each lobe, and no adventitious sounds present, and they're symmetrical.
Like wait. Yeah. That's fine. Or do you want? Doesn't matter. Okay. So I'm doing the anterior thorax. Oh my god. Okay. So when I'm inspecting her thorax, I see that she's wider from side to side than front to back. She's about like a 2-to-1 ratio. And the shape is slightly elliptical.
Her shoulders are at the same height and her chest walls are symmetrical bilaterally. During her respirations, I see that she's not using any accessory muscles when she's breathing. Her depth is non-exaggerated and effortless, and her rhythm is regular. Make sure you do the respiratory rates. You could either do it with the pulse or now is what I'm going to mention. So respiratory rates about 18. And then I'm gonna auscultate her breath sounds and see if she has any adventitious sounds. Okay, so bronchiovesicular and vesicular sounds were heard. There were no adventitious sounds heard either. Now, I'm gonna inspect for the cardiac landmarks, and no pulsations are noted upon inspection. And I'm gonna palpate for thrills or heaves.
I think you guys only doing the lungs for the anterior thorax.
We have cardiac landmarks.
Oh, see.
Yeah, I was confused about that.
What does it say? So is it just this part then? Can you do this? Go look at this one.
Okay. So first I'm going to inspect the cardiac landmarks. There's no pulsations on top, no pulsations in the lower landmarks, and then I'm going to palpate for thrills and heaves. So I'm going to start in the aortic. No thrills or heaves. No thrills or heaves. No thrills or heaves. And no thrills or heaves. And now I'm going to auscultate. And then I'm going to flip it over to listen to murmurs. And during that, only S1 and S2 were heard, no additional heart sounds. Okay, and there were no murmurs heard in any of the cardiac landmarks.
I'm going to go ahead and inspect the stomach. Patient has a flat contour, no masses or venous patterns noted. I'm going to go ahead and auscultate all 4 quadrants. Okay. Intermittent high-pitched gurgling heard in all 4 quadrants, and they were normal active. I'm going to go ahead and percuss all 4 quadrants.
Okay, tympani is heard upon percussion. I'm going to go ahead and lightly palpate. Do you feel any tenderness, pain?
No.
I'm going to deeply palpate.
Make your hands a little flatter than that, Miss Hannah.
Okay.
Thank you.
Okay. Any tenderness?
No tenderness.
Okay. And no masses or enlarged organs detected.
Alright, so color for the lower extremity is even with the rest of the body. There's no vascularity, there's no lesions. Color of the nails are pink except for one. Nail's dead. On this side, color is pinkish. There's 2 nails that's dead. Constant play with basketball, that's why. Capillary refill. It's less than 3 seconds for both sides. And now for dorsal pedialis. They are symmetrical bilaterally. Now for posterior tibialis. They are equal bilaterally and they're all +2s. Okay, now we're gonna assess for your motor function. Can you rapidly tap your feet for me? Okay, good. Now can you run your heel down to your tibia? Let's start with your left heel, please. Now your other one. Alright, you can now draw the number 8 in the air. Good job. Now the other one. Good job. Alright, now can you please sit so I can test for your D-turning? They're both +2s. Done.
So as the patient stands, I'm going to stand right next to her. So what I'm going to have you do now is I'm just going to have you bend. So just reach for your toes for me. And I'm just going to pop it for your spine. So your spine is aligned medially. I don't feel any signs of kyphosis, lordosis, or scoliosis. And because you're already like that, you are flexing with a 90-degree angle. Okay, can you hyperextend for me? Perfect. Okay, can you do lateral bending? Other side. Okay, can you rotate your spine? Okay, the patient is able to do full range of motion of her spine. Okay, next what I'm going to test you on is your gait. So, can you walk towards me? Perfect. Okay, turn around and walk heel to toe.
Okay, so the patient's gait is smooth and rhythmic. Okay, are you able to stand on one foot with your eyes closed?
Yes.
Okay, your other foot? Perfect. Okay, so you were able to stand on one foot without any swaying or no sense of imbalance, and are you able to hop on one foot in place?
Yes.
Okay, now your other foot. Perfect, and it seems that you have equal bilateral strength on both of your feet.